Hey everyone, and welcome back to Evergreen Health Tips. Let's talk about farts. Farting. It's a universal human experience, as natural as breathing or, well, eating. While often a source of embarrassment or humor, passing gas is a perfectly normal bodily function. In fact, it's a sign of a healthy digestive system at work. Our bodies are incredibly complex machines, constantly breaking down food and absorbing nutrients. This process inevitably produces gas as a byproduct. Rather than keeping it bottled up inside, our bodies have a clever way of releasing this gas through, you guessed it, farts. So, the next time you feel a rumble in your tummy followed by an urge to let one loose, don't be ashamed. Embrace it as a sign that your body is doing its job. After all, a healthy gut is a happy gut, and sometimes a happy gut needs to toot its own horn, or, release some gas. Let's delve deeper into the fascinating science behind fart formation. It all begins with what we eat. Food travels down the esophagus to the stomach, where it gets broken down by stomach acid. Then it moves on to the small intestine, where most nutrients are absorbed. However, not everything we consume is easily digestible. Fiber, for example, is a type of carbohydrate that our bodies struggle to break down fully. This undigested food reaches the large intestine, home to trillions of bacteria. These bacteria feast on the leftover food, producing gases like hydrogen, carbon dioxide, and methane as byproducts. This buildup of gas in the intestines creates pressure, which our bodies relieve by expelling it through the rectum. In other words, we fart. You might be wondering, how much flatulence is too much? It's a common question, but the answer isn't always straightforward. On average, people pass gas anywhere from 5 to 15 times per day. Yes, you read that right, up to 15 times. Factors like diet, gut bacteria, and even individual anatomy can influence gas production. So what's normal for one person might be excessive for another. The key is to pay attention to your body and establish your baseline. If you're consistently farting significantly more than usual or experiencing discomfort along with it, it's worth investigating further. Keep a food diary and track your symptoms to see if you can identify any triggers. This information can be helpful if you need to consult a healthcare professional. Section 4. Food, glorious food. The impact of diet on gas. As we learned earlier, the food we eat plays a crucial role in gas production. Certain foods are notorious for their gas-inducing properties. These include cruciferous vegetables like broccoli, cauliflower, and cabbage, as well as beans, lentils, and onions. These foods contain complex sugars and fibers that our bodies have a hard time breaking down. When these undigested carbohydrates reach the large intestine, those gas-producing bacteria have a field day, leading to increased flatulence. Dairy products are another common culprit, especially for individuals who are lactose intolerant. Lactose is a sugar found in milk and dairy products, and people with lactose intolerance lack the enzyme needed to digest it properly. This results in bloating, gas, and other digestive discomforts. Section 5. Lifestyle and other factors. Beyond the plate, while diet plays a significant role, it's not the only factor influencing gas production. Lifestyle choices and other factors can also contribute to those rumbling tummies and unexpected toots. Swallowing air, for example, is a common and often unconscious habit that can lead to increased gas. Talking while eating, chewing gum, and drinking carbonated beverages can all introduce more air into the digestive system. Stress and anxiety can also wreak havoc on our gut health. When we're stressed, our bodies go into fight or flight mode, diverting blood flow away from the digestive system. This can slow down digestion and lead to bloating and gas. Certain medical conditions, such as irritable bowel syndrome, inflammatory bowel disease, and gastroesophageal reflux disease, can also cause excessive gas and bloating. Section 6. Taming the toots. Tips for managing gas. Dealing with excessive gas can be uncomfortable and embarrassing, but there are steps you can take to manage and reduce it. Start by identifying and avoiding trigger foods. If you suspect certain foods are the culprits, try eliminating them from your diet for a few weeks to see if your symptoms improve. Then, you can gradually reintroduce them one by one to pinpoint the specific offenders. Eating smaller, more frequent meals can also aid digestion and reduce gas production. Instead of 3 large meals, aim for 5 or 6 smaller meals throughout the day to give your digestive system a break. Chewing your food thoroughly is crucial for proper digestion. The more you chew, the smaller the food particles become, making it easier for your body to break them down and absorb nutrients. This can also help prevent undigested food from reaching the large intestine, where it can ferment and produce gas. Section 7. Conclusion: when to worry, when to relax. Remember, farting is a natural and healthy bodily function. While occasional gas is nothing to worry about, persistent or excessive flatulence accompanied by other symptoms like abdominal pain, diarrhea, or constipation could indicate an underlying medical condition. If you're concerned about your gas or experiencing any unusual symptoms, don't hesitate to consult a healthcare professional. They can help determine the cause of your symptoms and recommend appropriate treatment options. Living a healthy lifestyle that includes a balanced diet, regular exercise, and stress management techniques can go a long way in promoting optimal digestive health and keeping those toots under control. Don't forget to like, comment, share, and subscribe to Evergreen Health Tips to stay updated.